Good afternoon. Governor Meyer here, joined by Secretary Josette Manning of Delaware Health and Social Services and numerous elected officials behind me, a number of whom you'll hear from. We're here today about something that's not a partisan issue. We're here today about protecting working people in our state and across our country. Working people are doing everything right, but are struggling to get by. We're talking about extending tax credits that House Resolution 1 passed in the Big Bill Act back on July 4th is just about to dramatically increase the cost of health care for Delawareans. Good afternoon, and thank you for being here today, both in person, via Zoom, and watching on social media. We've drafted a letter that's now been signed by 18 governors across our country and sent to congressional leaders in Washington. And now we're calling this press conference because Delaware families and families across America, working people, are facing a crisis if Congress doesn't act. In just 45 days from today, open enrollment for health insurance begins. Through the Affordable Care Act marketplace, millions of Americans are going to find their premiums have gone up, in many cases, by thousands of dollars a year. Here in Delaware, thousands of our neighbors are projected to lose the subsidies that keep their health care within reach, with many unable to find a new plan at all. These are working Americans, by and large, and it's politics that doesn't belong between you and your doctor. When families are forced to choose between paying for housing, grocery, or health care, our entire economy suffers right here in Delaware, in the region, and really across our country. Extending these marketplace credits is one of the simplest ways for Congress to bring relief to households that are already stretched thin, and one of the most effective ways to foster long-term economic growth. For me, this is not abstract. My wife, Lauren, is an emergency room doctor. She's at the hospital right now as I speak, working. And every day she sees the cost of delay. Patients who put off checkups, skip their medicine, or wait until they're in crisis because they simply couldn't afford care earlier. Several of the individuals behind me are people who in the past have been caregivers or are currently caregivers and see that among their patients. These aren't statistics. These are parents, small business owners, older adults not yet on Medicare. These are our neighbors. If Congress, U.S. Congress, lets these tax credits expire, families across Delaware will be forced into impossible choices as a direct result of their action. Rural regions, in particular, rural parts of our state in Kent and Sussex County particularly, could see premiums that have been predicted to spike something like 90%, nearly doubling healthcare costs. And the ripple effects are going to hit communities across our state. They're going to hit every hospital in our state and nearly every hospital across our country, and they're going to impact nearly every small business in our state. We know the solution. Extending these tax credits is not complicated. As I said, it's not partisan. It's common sense. These credits have already helped bring more Americans into health coverage than ever before. They're one of the most effective tools we have to protect families and strengthen our economy. So my message today is simple. Congress must act, and they must act now. Let's not wait until families are blindsided by sticker shock of just getting basic health insurance this fall and winter. Let's make sure every Delaware family, every working American can count on affordable health care, not just this year, but for years to come. At the end of the day, health care is not optional. It's the foundation of strong families, strong communities, and stronger Delaware. Thank you so much. You're going to hear from a number of leaders across our state who are working tirelessly to make ends meet for Delaware families in spite of these challenges. First, we're going to hear from our great Secretary of Health and Social Services, Josette Manning.
Good afternoon. Why are enhanced premium tax credits so important? Because without them, more than 50,000 Delawareans stand to lose their health insurance. We already know that in 2024, 1 in 4 adults in the United States skipped or postponed health care because of costs. And that was with the enhanced premium tax credits in place. The end of enhanced premium tax credits would force many Delaware families to make hard decisions, such as whether to fill the refrigerator or the medicine cabinet. Recent data shows that when people have to make that choice, 63% of them cut back on food, clothing, or basic household items. We cannot ask people to choose between basic life necessities like healthcare coverage and the food they put on their table. And if people don't get the care they need, they will become sicker, which will place an even greater demand on our state's already stretched healthcare system and significantly increase the cost of care. If you do not receive preventative care or immediate care for an illness, your health outcomes will be worse, and the cost of treatment down the road will be higher. Caring for the chronically ill is exponentially more expensive than keeping people healthy. How do we keep people healthy? With access to health care. How do we give them access to health care? Things like the enhanced premium tax credits. They are not just frivolous giveaways. They are subsidies that are tied to income. So the more you make, the less of a credit that you receive. If you can afford to pay, you will. But these are absolutely necessary for those in lower income brackets because without them, they simply cannot afford the coverage. So as a concrete example, if you are a 40-year-old making $31,000 a year, which I think we all know is barely livable, your health insurance premium could go from $58 a month to $153 a month without the enhanced tax credit. That's an extra $95 a month for someone who is probably already barely making ends meet. The choice is simple. It's accessible health care now and healthier citizens at a minimal cost, or excessively high health care costs later and very unhealthy citizens. Why is this even a debate? As the governor said, this is common sense. Cutting these enhanced premium credits shouldn't even be on the table. I want to thank the governor for taking up this charge and our congressional delegation for helping carry the torch. And with that, I also want to thank our Department of Insurance, who has worked tirelessly to protect our citizens and ensure accessible health care here in Delaware. So it is my honor and privilege to introduce to you the Deputy Insurance Commissioner, Tanisha Merced.
Good afternoon, and thank you, Secretary Manning. I'm Deputy Insurance Commissioner Tanisha Merced. Insurance Commissioner Trinidad Navarro and our team encourage Congress to extend the enhanced tax credits that so many Delawareans rely on. Whether in the halls of Congress or in the Delaware legislature, whether in the courts or in the rate filings, our team works day in and day out to fight the federal forces that are raising consumer costs. Because the fact of the matter is, under this federal administration, the cheapest health care bill you'll ever pay is the bill you pay today. With the cost of care increasing every day, residents are facing tremendous financial pressure, and insurers are too. But we know how to improve the health and address costs. In the time since the credits were expanded, enrollment more than doubled in Delaware's marketplace, which allowed us to bring in competition to an already and still small marketplace. Of our more than 50,000 Affordable Care Act enrollees, nearly 46,000 were supported by tax credits. That's 92% of the policyholders. And the credits brought down premiums an average of $538 a month and more than $6,400 a year. But congressional inaction wouldn't just impact individual enrollees' expenses. Enhanced subsidies increased enrollment for the youngest and healthiest residents, and losing them will adversely impact our risk pools, further increasing premiums for Delaware's most significant cohort of enrollees, those pre-Medicare residents aged 55 to 64. It would also affect our state's reinsurance program, which brought double-digit rate decreases to residents. And the economic impact of increasing the uninsured population by an estimated 8% in Delaware by allowing these tax credits to expire will also harm our healthcare providers, hospitals, and pharmacies who are already facing challenges due to other federal coverage costs. This could also lead to approximately 800 job loss, 400 in the healthcare specifically. This spring, the insurance commissioner and our team required carriers to prepare rates for the possible extension of these important tax credits so that we can rapidly respond and decrease the rates before open enrollment begins on November 1st if Congress takes action. Now is not the time to make America less healthy. Now is not the time to make America less affordable. Now is the time to act. And now I'd like to bring up Senator Pinckney. Thank you.
Good afternoon. I am State Senator Marie Pinckney. I represent the 13th Senatorial District. It is parts of Newark, Newcastle, and Bexar, and it is also a district that has been historically plagued with disproportionate instances of triple-negative breast cancer. It is a district that is majority minority populations. It is a district of people who are going to be the beneficiaries of the enhanced tax credits if we continue to keep them. I want to reiterate a question that our secretary asked. Why is this even a question? Why are we talking about taking health care away from people in a country that is one of the sickest in the world? I am talking about, as a social worker, I've seen the outcomes that people have when they do not have access to quality health care. The differences in healthcare outcomes are drastic if people do not have access to quality providers and quality health care. I'm not just talking about small differences, I'm talking about the difference between life and death for people. We've already heard that when people have to make the decisions between their health care and their households, we're putting them in awful positions. One is going to lead to an increased burden on the other. If you can't have good health care, you're not going to be able to take care of your home. If you can't take care of your home, it's going to be a burden on your household. As a government, we are supposed to be taking care of the people who put their faith in us, and taking away this access to quality health care, to affordable health care, would make us negligible, would make us irresponsible, and is not what we have been elected as a country to do. So I am grateful to our governor, Governor Meyer, for taking up this charge, in addition to all of the other states who are pleading with our federal government to do with the job that they have been elected to do, and to protect U.S. citizens and help us as a legislature and an executive branch protect Delawareans. Now it is my pleasure to introduce my colleague in the Senate, Senator Ray Siegfried.
Thank you, Senator Pinckney. And thank you, Governor Meyer, for taking this up. And I want to thank my colleagues for joining us here today in support of this very, very important issue. Let me just say that there can be no more fundamental moral obligation than couples caring for each other. No greater moral responsibility for a parent caring for their child. No higher calling for a religious leader than caring for their congregation. And indeed, no more fundamental purpose for a representative, a senator, a governor, and yes, a president, than caring for the people that they serve. Let me put it simple. The moral test of government is how it cares for its people. One way that this moral test is operationalized is through affordable health insurance, which is really the gateway, if you think about it, to care. A country whose people live in fear of being denied their health care, especially a country that excludes its poorest citizens from access to health care, can never be a great country. So, Mr. President and members of Congress, renew the premium tax credit so that people that you serve can continue their access to care, a fundamental right in this country. Thank you very much. And now let me introduce my dear colleague from the Senate, Senator Dan Cruz. Dan?
Good afternoon. I want to take just an additional minute to color in who we are talking about today. Which of our neighbors are we talking about that are at risk or additional risk? In my district, when I knock on doors, when I go to civic meetings, when I go to the park, from Trolley Square to the Triangle neighborhood, from Brandywine Village up to Bellefonte, almost every conversation is about affordability and how much our neighbors are being impacted by how much so many things cost. When we talk about healthcare, these are the neighbors that we're talking about. My colleagues behind me, my friends in the room, and I hope at some point everyone in the public that's listening now and in the future in our state will be familiar with the term ALICE. I can see the governor's face behind me right now. ALICE is an acronym. I say this all the time, but I do it all the time because I want to move this into our vernacular. Asset limited, income constrained, employed. The E at the end of ALICE is so incredibly important. These are our hard-working families, our hard-working young professionals, our senior citizens on fixed income, and they're quiet, they're silent, they're invisible. When you look at the data in our small state with our federal poverty level, Delawareans, incredible population that we need to continue to resource around. And then you look at our ALICE population, which can vary slightly depending on census tract and geography, but we'll round up. When you put those two numbers together, I want you all to pause with me when I say this. We're at around and over 40% of our neighbors. That's who we're talking about today. If you don't think you know who this impacts, you do. Our ALICE neighbors are all around us. These are our paraprofessionals. These are our vet techs. These are our teachers in some cases. These are the folks that work with us in our professional environments, and you just don't know it. So when we advocate, when we stomp our feet, like we were doing earlier today, I want us all to remember that it's for so many more people in our state, so many more of our neighbors than we might actually realize, and we're doing it for them as well. Thank you. And I have the pleasure of introducing Representative Burns.
Thank you. Good afternoon, everyone. Thank you, Senator Cruz, Governor Meyer, and all of you who are here in attendance. I rise today to stand with Governor Meyer to urge the extension of the enhanced premium tax credit under the Affordable Care Act, credits that have been a lifeline for millions of Americans. These enhanced subsidies, first expanded under the American Rescue Plan, made health insurance more affordable than ever before. They allowed a record number of people, over 21 million across the country, to enroll in marketplace coverage. That's not just a number. And by the way, I represent the 21st district, and if you take the 21 million, the 46,000 we know are in Delaware, that's over 1,000 people in each representative district that are on this coverage. So it represents, at a minimum, several hundred of my constituents that are going to be affected by this directly. But it's not just a number. It's a single parent finally being able to take their child to the doctor without worrying about the bill. That it's the small business owners just trying to get started out, no longer having to choose between keeping their business afloat or insulin. If we allow these enhanced credits to expire, we will see premiums skyrocket, some by as much as 50%, and millions of Americans will either be priced out of coverage or forced to choose between essentials like rent, groceries, and health care. Health care is not a luxury. It's a basic human right. And no one should have to gamble with their health or their finances because Congress has failed to act. Extending these tax credits is not just sound policy, it's the morally right thing to do. Let's protect the progress we've made. Let's keep families covered. No Delawarean should go without health care. Congress, please act. Thank you.
All right, we are now going to take questions from the press. We'll start with Sarah Petrovich, Delaware Public Media, and then we have several virtual tuning in. Governor?
Governor, my question is just, have you had any type of response from the congressional leadership at this point, or any conversations at the federal level or with Delaware's federal delegation about a response?
I saw the Speaker's office send a note, thank you, received. I think that's the extent. I don't know if we've received anything other than that.
Anything with like Delaware's federal delegation about their work at Congress to try to make this happen?
I know from ongoing conversations they're working tirelessly on this issue. So. I don't know if there's a question on Zoom.
Oh, is it my turn?
Yep.
It is. Okay. How's everybody doing? Quick question for DOI or the governor. Prior to today's announcement, Celtic and Better threatened to pull its coverage from the state, allowing it to secure a much higher rate than the state intended. What is the state and policymakers? Are they aware of, what are they going to do to try and prevent this in the future? You mentioned it's already small marketplace, and with these credits going away, other providers might threaten to pull out as well.
That's correct. So AM Better did secure a rate that was higher than what the department would have preferred. However, it was actuarially justified. We did have our independent actuaries review it. What we continue to do is have conversations through our national association with carriers. We continue to encourage them to come to Delaware. We have conversations on a regular basis. We know that we've had the marketplace in the past only have one carrier, and we have continued to have that carrier long term. We have not heard from any other carrier that they will be pulling out of the market, even if the enhanced tax credits are not extended. So at this point, we believe we will have the same three carriers at least for a good amount of time.
Hi, thank you for taking my question. Democrats want the subsidies to be included in the short-term CR, but Republicans said today that they'd rather kick that discussion down the road. Do you believe that Democrats should stick to their guns in having this included in the CR, even if it risks a government shutdown?
Yeah, I don't think it's a Democrat or Republican issue. There are a lot of families who we all serve in districts across this state from north to south who can't kick the can down the road. When you're talking about increases that are doubling, tripling healthcare costs, it's something that urgently needs to be addressed. And I have encouraged, and I think they agree, our federal delegation, Senator Coons, Senator Carper, Congresswoman Congresswoman McBride, Senator Coons, Senator Blunt Rochester, Congresswoman McBride. And in fact, I've also encouraged legislators from other states, legislators who may not have a D next to their name, who seem sympathetic because they represent working people too. And so I'm encouraging them to do whatever it takes to roll up their sleeves and get this done and get it done in the next 45 days. Otherwise, the impact on Delawareans, like the impact on working people across this country, is going to be dramatic, and it's not going to be good. The notice of funding opportunity came out yesterday, I think. I haven't read through it. It's something like 150, 160 pages. We have, from the RFI, we did requesting initial information from people across Delaware. We have hordes of ideas. We're sifting through them now, and we'll, make sure it complies and with the notice of funding opportunity, and submit a really competitive application to make sure hospitals and health systems, particularly in the most rural parts of our state, are shored up through this really challenging time.
We can get you more background on the process as well. Any other questions?
Yes, good afternoon, Governor. This is Katie Taven with the Delaware Business Times. I'm curious about what your conversations with the hospital executives right now in Delaware are like about this issue.
Look, it's challenging. It's a great question, Katie, because when it comes down to it, as I think Secretary Manning referenced, listen, what does this actually mean when we're talking tens of thousands of Delawareans lose their health insurance? My wife will tell you they still come to the emergency room, right? When you go to the emergency room under federal law, they're required to see you whether you have insurance or not. So we're talking about people going to less efficient care. We're talking about people not going to a primary care provider or a specialist when they need to, because they won't be able to see them when needed. And the consequence of that is they go to emergency room. There's no health insurance to pay. So who pays? Well, in many cases, the hospitals and healthcare providers need to eat that cost. And so what does that mean for them? Well, they're going to increase costs on all of us to pay for that. And so it's really a way of increasing costs for people across America, increasing health costs at a time when health care costs are among the highest stresses on American working families. You're making it more expensive and creating disincentives to use the healthcare system in the way we want it used. So I think preliminary conversations that we've had in the last few months is this could get, it could get to a really bad place, both economically and both in health outcomes. And we're going to do everything possible in Delaware, working with these fine individuals behind me, and quite a few are not in this room, to do everything we can to protect Delawareans in spite of federal policies that don't really seem.
I did have one more question, if you can hear me. Spotty audio right here. What is the game plan if these subsidies aren't extended? What's the game plan for the state and the Delaware Department of Insurance?
Is created by action out of Washington, D.C. that's really bad for Americans and bad for Delawareans. We're going to do everything we can to protect Delawareans. To all of us, we know real people and real families, hardworking people who deserve the best 21st century health care. And we're going to do everything we can to protect them. I don't know if Tanisha or anyone has anything to add.
All right, any other questions? And if you had any audio issues, we can get you the recording as well. Okay, great.
Thank you.
Oh, sorry. Nick?
Are there going to be any initiatives in the state to subsidize these losses should they not come through at the federal level?
Certainly we're looking at it, but you're also looking at some changes to the federal tax code that are potentially causing dramatic decreases in revenue for the state. You're looking at dramatic increases in costs unrelated to this, but related to Medicaid and SNAP cuts, increasing the administrative burden and other things. And so when you talk about increasing the state costs, that's challenging because of other federal action. So we're going to do everything we can.
Thank you.